Good day. I am Dr. Rinaldo ROJoson. I was asked to give a lecture with this title, Systems Thinking in Healthcare Facilities for HA 202, with a time limit of 30 to 45 minutes, and with the following prescribed learning outcomes or objectives. Understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Understand the importance of alignment and integration in managing a hospital and its departments. Describe a hospital design, department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And lastly, discuss common challenges encountered in governance of departments together with their suggested strategic solutions. With these prescriptions given to me by the course director, I shall delimit my presentations on health facilities to the hospitals with focus on the departments rather than on the whole hospital. Thus, I will change my title then to Systems Thinking in Hospitals with focus on departments so that I will be aligned with the learning outcomes or objectives. Let's start with the structure and basic functioning of hospitals. All hospitals are made up of different departments and services. We look at the hospitals as a system that is set of interrelated but separate parts working towards a common purpose. As hospital managers, we must know how to manage the hospital effectively and efficiently by making sure that all the various different departments and services are aligned and integrated with their governance and functioning. Systems perspective, systems approach, and systems thinking are various terms that one will encounter in management discipline manuals, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of interrelated parts of a system. Suffice it to say that systems perspective or approach to management views the organization or the hospital and also the department of a hospital as a unified, purposeful system composed of interrelated parts. This perspective or approach makes the manager sees the organization as a whole and as a part of a larger external environment. System thinking, on the other hand, is a holistic approach to analysis that focuses on the way that the system's constituent parts interrelate and how systems work over time and within the context of larger systems. Put it in another way, systems thinking is basically a way of helping a manager to view the systems from a broad perspective that includes seeing overall structures, pattern and cycles in systems, rather than seeing only specific events in the system. This broad view can help the manager to quickly identify the real causes of issues in organizations and know just where to work to address them. Systems perspective, approach, and thinking are management disciplines that are concerned with an understanding of a system by examining the linkages and interactions between the components that comprise the entirety of that defined system. The bottom line of systems perspective, approach, and thinking is the recommendation for all managers to view and analyze situations in the hospital and departments holistically and comprehensively, and to always look at the interaction of parts to other parts and to the whole, and vice versa, with alignment and integration as key result areas and key performance indicators. What is alignment? Alignment is a state of consistency among plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis that support key organization-wide goals. This is a definition from Baldrich's healthcare criteria for performance excellence. Alignment means consistency between hospital plans and hospital goals, between department plans and department goals, and between department plans and hospital goals. In other words, quality of doing things towards the same direction. Thus, to be aligned, all staff should be clear about the hospital's purpose and policies and procedure, as well as those of the department, and make decisions in accordance with them. What is integration? Integration is the harmonization of plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis to support key organization-wide goals. A definition from Baldrich's healthcare criteria for performance excellence. Integration means harmonization between and among all parts in the hospital and departments to produce a unified outcome or goal. It is said that effective integration goes beyond alignment and is achieved when individual components of a system operate as a fully interconnected unit, such as the harmonization of music by an orchestra. In effecting harmonization and integration, it is implied that coordination or synchronization and collaboration or cooperation of the various parts are very important. This slide illustrates the concept of alignment in number 3 and integration in number 4. The ultimate target is an integrated approach or integrated process, shown in number 4. Number 1 illustrates the complete absence of uniform or consistent direction of the arrows or processes. All are in different directions. This is the phase in which the organization is just reacting to problems. Number 2 illustrates some amount of uniform or consistent directions of the arrows or processes. This is an improvement of the first phase. This is the phase of early systematic approach, which should be further developed into an alignment and eventually integrated approach. As I said, the ultimate target is integration. As mentioned earlier, in effecting harmonization and integration, coordination or synchronization, and collaboration or cooperation of the aligned parts are very important. This slide shows alignment on the left side. Then with coordination and collaboration of parts, integration is achieved. These are keys to performance excellence of hospitals. Back to systems thinking in hospitals with focus on departments. As mentioned earlier, all hospitals are made up of so many different departments and services. The number varies from one hospital to another. The minimum number will be the ones imposed by the Department of Health licensing body. Level 1, basic departments and services. Level 2, with medical specialties but without training departments, thus with more departments and services than level 1. Level 3, with medical specialties and with training departments, thus with more departments and services than level 2. Examples of hospital departments and services: under Medical Services Department, Department of Emergency Medicine, Outpatient Department, and Inpatient Department. Under Diagnostic Departments, Laboratory Medicine, Radiology, and Nuclear Medicine. Under Treatment Departments, Operating Room Complex, OBGYN Complex, rehabilitation medicine department, medical specialty departments, nursing services, and dietary department. Under medical support departments, facility management department, housekeeping department, security services, billing and cashier department. Under administrative support departments, quality and patient safety department, materials management department, human resource development department, business development department, finance and accounting department. Other departments and services can be created on the basis of needs as deemed by the administration of the hospital. Thus, roughly, a hospital can have the minimum of 25 departments and services. The number could be more, up to 50 or even more. This slide illustrates the importance of alignment, coordination, collaboration, and integration of all the departments and services to effectively and efficiently achieve the performance excellence of the whole hospital. Let's now focus our discussion on departments. Just as the hospital is made up of different interrelated parts in terms of departments and services to facilitate achievement of its corporate goals, each department and service is also made up of different interrelated parts to facilitate achievement of its authorized functions and services. Each department and service is also considered as a system, just like a hospital. The hospital can be called the super system, and the departments and services within the hospital are subsystems. Each department and service must utilize systems perspective, approach, and thinking in management as just like in the whole hospital. That is, understanding the systems by examining the linkages, interactions between components that comprise the entirety of that defined system, viewing and analyzing situations in the department holistically and comprehensively, and to always look at the interaction of parts to other parts and to the whole, and vice versa, with alignment and integration as key results areas and key performance indicators. Not to say there must be alignment, coordination, collaboration, and integration of each department and service with the whole hospital and with the other departments and services. This slide illustrates hospital and departments as systems with interrelated parts, with the hospital being the super system, with the various departments as subsystems, and the interfacing departments as co-systems. Each department is also a system by itself with interrelated parts or processes. When planning and when doing problem solving, all managers should have a perspective and analytic thinking that look at the parts simultaneously, at the whole, and vice versa. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external and internal environment. The key result areas of the system approach and thinking, analytic thinking, should be alignment and integration of all subsystems or parts towards achievement of a department's vision, mission, goals, and objectives, and eventually the hospital's vision, mission, goals, and objectives. This slide shows the essential and basic components of the department which must be present to facilitate accomplishment of its authorized functions and services, as well as achievement of its goals. The boxes are leadership, authorized functions, authorized services, goals, architectural design and engineering construction, physical structure, DOH licensing and structural requirements, policies, procedures, risk management system, human resource program, equipment material program, data document records program, business development program, budget program, IT-enabled system, regular performance evaluation, and continual improvement program. All of these components must be present, aligned, and integrated with each other in order to achieve performance excellence for the department. On the extreme left of the slide, one sees the need for alignment and integration with the whole hospital as well as the other departments in the hospital. This slide illustrates the super system, which is the hospital, subsystem, which is a particular department, and cost system, which is an interfacing department. The arrows indicate the need for alignment and integration of all parts of the system, the department, with the super system, the hospital, and the cost system, the interfacing departments. At this point, I'd like to disclose that this department design and development framework or administrative design and development program for a department was developed by yours truly in 2010 to facilitate learning, planning, and administration. This department design and development framework is applicable to all kinds of department and services in the hospital, such as the emergency room, surgery department, operating room, housekeeping department, etc., etc. To fully develop this framework, there must be a manual that contains a description, elements, and management system for each box, the so-called design and development blueprint. After the design and development blueprint, there must be evidence of implementation and evaluation of the results of implementation. I shall now discuss the hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. On the extreme left of the framework, there are 4 boxes that refer to the hospital and interfacing departments. Whatever be the department, the administrative design and development program should be aligned and integrated with the whole hospital's concepts and design, the whole hospital's governance policies and procedures, the whole hospital's operations policies and procedures, as well as the interfacing unit's operations policies and procedures. In other words, there must be a systems perspective or systems thinking. Leadership. Whatever be the department, there must be a competent head with at least the following competencies: unit technical requirements, competency on the specialty of the department, hospital teamship or team playership, managership, and leadership. There must be at least job descriptions, job specifications, and performance evaluation system of the leaders and managers. Functions. There must be a document stating the authorized functions of the unit. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. Service. There must be a document stating authorized services of the unit. Services offered and functions authorized must be congruent with each other. Goals. There must be a document stating the ultimate goals, which must be aligned and integrated with the goals of the hospital. The basic and essential goals are performance excellence, client engagement, quality and safe healthcare services, cost-efficient or value-based services, and maximal utilization of services. All these goals should be should eventually be contributing to the financial viability and sustainability of the hospital. This slide shows the basic processes of management in the department design and development framework. The inputs, which consist of leadership, functions, and services on the left side, the outputs or the goals on the right side, and the throughputs, all the boxes in between the inputs and the outputs. DOH licensing and structural requirements. This just means compliance to DOH or Department of Health guidelines in the planning and design of a hospital and other health facilities, safe hospital initiatives, building code, fire code, local government requirements, etc., etc. Physical structure. This refers to a geographical space or area in the hospital to construct the department to receive patient clients and physician clients requesting for services and to house the staff who will perform the functions of the department. Service requirement, as dictated by authorized function, should be the first determinant of physical structure of a department. Other determinants of physical structure, statutory and regulatory requirements, DOH licensing requirements, building code, fire code, local government requirements, specialty requirements, particularly on training and research, human resource program, equipment and material program, data, documents, records program, budget program, risk management program, business development program, quality standards, community expectations, efficiency, caseloads, honors ones. Architectural design, engineering, construction. This will be dictated by the DOH licensing and structural requirements as well as the physical structure requirements. Human resource program. There must be a document showing job descriptions, job specifications, and performance evaluation system of the human resource in the department. There must be documentation of adequacy in number and in competency of the human resource. Equipment material program. There must be a document showing adequacy of the equipment and materials needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services, statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. Data, documents, and records program. There must be a document showing adequacy of data, documents, and records needed to facilitate an effective and efficient functioning of the unit in consideration of the key functions and services, statutory and regulatory requirements, and other objectives like business development, risk management, and IT-enabled system. Business development program. There must be a document showing the presence of a structured and comprehensive program that will develop the business of the unit to make it viable and sustainable. Budget program. There must be a document showing a budget that projects future income and expenses of the unit, and the budget is being used as a guide for day-to-day performance and financial evaluation at planned intervals. Risk management program. There must be a document showing a risk management program, which is a plan and systematic process or program to reduce and or eliminate the probability of a risk that usually result in injuries, losses, and legal suits. The risk management program can also include risk with potential positive effect, like improving business and client engagement. IT-enabled system. There must be a document showing the use of computer technology or IT to promote efficiency in performance of functions and accomplishment of services, to manage information of the unit, such as getting, storing, protecting, processing, transmitting, and later retrieving as necessary, to create interconnection with other units in the hospital for timely communication, coordination, collaboration, in accomplishment of services of the unit, and to communicate with patient clients and physician clients both in and out of the hospital. Policies and procedures, clinical practice guidelines, clinical pathways. There must be documented policies and procedures, clinical practice guidelines, clinical pathways that serve to provide order, to promote standardization, to facilitate communication, to promote effectiveness and efficiency, to provide guide to present and future staff, among other things. The policies and procedures of the department must be aligned with those of the hospital. They should be reviewed and revised periodically. Clinical practice guidelines and clinical pathways are akin to policies and procedures, but focus more on patient management. Clinical practice guidelines is defined as systematically developed statements built on synthesis of evidence, which provides formal recommendations about appropriate and necessary care intended to assist practitioner and patient to make decisions about appropriate health care for specific clinical circumstances. Clinical pathways is an interdisciplinary plan of care that outlines the optimal sequencing and timing of interventions and expected outcomes for patients with a particular diagnosis, procedure, or symptoms. The last box, regular performance evaluation and continual improvement program. There must be a document that shows a program to appraise the extent of accomplishment of the unit in its authorized functions and business plans at planned intervals, such as quarterly, biannually, and annually, and to determine the areas of improvement and to act on them. Let's now go to the last learning objective, common challenges encountered in governance of departments together with their suggested strategic solutions. The challenges can be in at least 5 categories: man, system and methods, machine, equipment, money and other resources, trends in hospital industry, healthcare, and medical sciences. Under demand categories are the consultants, the residents, colleagues in other units, chief of hospitals and bosses, subordinates. The common problems are competencies, quantity, alignment, coordination, collaboration, and integration, and personality. Suggested strategies consist of leadership and managership skills, managing your boss, meaning managing his personality, adjusting accordingly to his or her mindset and mood, the use of multi-sectoral, multi-professional committee membership to engage everybody into alignment, coordination, collaboration, and integration. Under the system and method category, common problems are lack of systematization in doing things, lack of standardized procedure, suggested strategies, use of DOH licensure requirements as guide, use of quality standards, manuals as guide, such as PhilHealth Benchbook, Joint Commission International, and Accreditation Canada International, establish policies and procedures, clinical practice guidelines, and clinical pathways. Under the machine equipment category, common problems are lack of management system, lack of calibration, lack of preventive maintenance of machine and equipment. Suggested strategies, policies, and procedures. Under money and other resource category, limited resource is always a problem. So the suggested strategies, leadership, innovativeness on how to get the money. Under trends in hospital industry, healthcare, and medical science category, the most common problem is the rapid changes in trends, which oftentimes are difficult to cope. Suggested strategies, knowledge management system with constant tracking of development and changes and continual education, benchmarking with other departments or other hospitals, and innovativeness. I like to end my lecture by flashing again the topics that I have covered. And some of my take-home messages are, for the first prescribed learning outcome, how to run and manage a hospital effectively and efficiently by systematically using the system approach or perspective and systems thinking. I suggest you try to remember this slide that illustrates hospital and departments as system with interrelated parts, with the hospital being the super system, with the various departments are subsystems, and the interfacing departments as co-systems. Each department is also a system by itself with interrelated parts or processes. And when planning and when doing problem solving, all managers should have a perspective and analytic thinking that look at the parts simultaneously at the whole and vice versa. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external and internal environment. The key results areas of the system approach and thinking should be alignment and integration of all parts or subsystems towards achievement of the department vision, mission, goals, and objectives, and eventually the hospital's vision, mission, goals, and objectives. Second, learning outcomes, importance of alignment and integration in managing a hospital and its departments. Remember this slide showing the pictorial differences between alignment and integration and steps towards a mature process approach. The ultimate target is integration. Also remember this slide that illustrates the importance of alignment, coordination, collaboration, and integration of all departments and services to effectively and efficiently achieve performance excellence of the hospital. Third, learning outcome, hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. Remember and use this framework. It is generic. It is applicable to all departments. It is comprehensive. It facilitates learning, planning, and governance of a department. Just put in the details, the contents in each box, and compile them into an operations manual. Last learning outcome, common challenges encountered in governance of departments together with their suggested strategic solutions. Remember this starting table with 5 categories: man, system and methods, machine and equipment, money and trends. And recall the common problems under each category and my suggested strategies. You can add more as needed based on your settings and circumstances, particularly on these strategies. I really hope you have acquired the prescribed learning outcomes through my presentation. Thank you for your kind attention.